Satan should get an advantage of us, for we are not ignorant of his devices.
We will be under assessment, we will be under measure of computation in every aspect of our lives in the future. From what you eat, who you date, what you buy on the internet, how much energy you use, but also what are your vital signs, how well are you doing in terms of health, what kind of specific genetic quirks do you have, what's your genome telling about your health, about your mental health, about how well you are doing, how well you are aging, what kind of disease you are susceptible to.
It has a bit of an Orwellian twinge to it.
Well,
Imagine a future where illness can be treated with a small implantable device, a device that can cure you with simple electrical signals. It's not science fiction. The future is closer than you think.
Many of these things will be built directly into our bodies.
You've got this human genome project. We know what people's genomes are. Now you got to match it up to phenotype, so what's going on in their lives. And these gizmos and maybe this technology can help us have databases. I know that's a scary word, databases of health, which help us put it all together and figure out, what's going to happen to who, what should we do when. But of course, I would be remiss if I didn't bring up the topic that I'm sure all of you are thinking right now, which is you've got these, you're hearing about chips implanted in bodies. So I've got to ask you, Kevin, and then we'll flip it to the audience. Any possibility of people hacking into other people's neurological systems and causing mischief? Not that anybody has that type of mentality in our planet.
Tonight, CBS 2 News has learned prescription medications as we know them may soon be a thing of the past.
Replaced with tiny implantable microchips that can treat and potentially cure dozens of chronic diseases with high-tech healing. Taking daily prescription medication can be hard to swallow. But for millions of people who need them, pills may soon be replaced by this little microchip.
It will cure some diseases, and the chip will prevent others.
The chip is implanted in the body, where it sends little electrical currents, telling the nervous system to tell the body to heal itself.
The diseases that can be treated by this approach is a lengthy list. Cancer, diabetes, heart disease, stroke, Alzheimer's disease.
The chip is the brainchild of Dr. Kevin Tracy, a neurosurgeon with the Feinstein Institute for Medical Research on Long Island, which has launched a new field in healthcare known as bioelectronics.
The promise of bioelectronic medicine is to restore the activity of nerves whose function, for whatever reason, disease or aging, are now not functioning properly.
Tracy says the technology is extremely precise and there are no side effects. He compares it to how a pacemaker controls the nerves in the heart, except these new devices will control the nerves in the immune system.
Potentially nerves to cancer, tumors to cancer cells, nerves to the bowel and bladder.
Clinical trials for multiple tests are currently underway, and positive results have already been reported in treating conditions like rheumatoid arthritis, even appetite control.
I figured, what did I have to lose?
Virginia Vallis is one of the first to test a bioelectronic device for weight loss. Since starting the trial 4 years ago, she has lost nearly 100 pounds.
You get this feeling of fullness. It's like you just ate a nice big meal.
Embracing the future, drug makers like GlaxoSmithKline are looking ahead and funding research in this next frontier.
Every single disease that we have looked at, we found that we could potentially make medicines with bioelectronic intervention.
Bioelectronic devices are controlled by a smartphone or tablet and then programmed and monitored by the patient's doctor.